Okay, I'm just going to start by brushing through the hair. Be taking a look at the hair follicles, hair ends, doing some sensory tests. So, okay. And how long has this been going on?
2 weeks.
2 weeks. Okay. Just upon initial inspection, seeing that your hair is a little bit dry. Especially near the roots. I'm seeing a few flakes here and just bumpy spots. I'm going to be making a part right here. I'll just be looking at the sections of the scalp that I see issues. Okay. Just noticing there's some redness in the areas that you indicated you were having the numbness. So I'm just going to gently touch the part. Let me know if you feel this. Do you feel this light pressure?
Yeah.
Okay. Do you feel this light pressure?
Yeah.
Okay. And what about here?
Yeah.
Okay. Here?
Yeah.
And here?
No.
No? Okay, so the numbness might begin near the crown. Okay. I'm going to go ahead and mark that area. So, it's about a 1.5 inch diameter. Let's see if I can find any kind of flex here. Okay. Going to do a pressure point test, okay? So let me know if you feel 1 or 2 pressure points. This will be 1. This will be 2. Do you feel the difference?
Yeah.
Okay, say 1 or 2.
1. 1. 1. 2. 2. 1. 1. 1. 2. 2. 2. 2. 2. 2.
Okay.
2. 1. 1. 1. 2. 2. 2.
Okay.
2. 2. 1. 1. 1. 2.
Okay. Next, I'm just going to take a sample because I'm seeing some flakes here. Okay. Just want to make sure that this is just dandruff and not some kind of skin infection. Just the numbness worries me. And just the small flakes of red that I see might indicate cellulitis of the scalp, although I think it would look a lot worse if it wasn't infections, but I'm just going to make sure, so we're just going to get a very good sample here to send to the lab. Okay. Okay. All right. Okay. So I'm going to take some measurements of the scaly patches, so just bear with me here. Okay, this is 2 centimeters. Okay. This is not quite. This is about a half centimeter, and I'm seeing some purpling here. That's the 8th to the top of the hairline. Okay. Okay. Next, I'm just going to do a section here. It's a little bit off the part. That's 2.5. 2.5. Okay. And just one more section here, and this is off towards the back of the scalp, like how you mentioned. That's 1.5 centimeters. Anything over 2 centimeters would indicate a problem. So you're just on the cusp of you're getting bad, so I'm glad that you came in today. Okay. So next I'm going to do a temperature sensations test, okay? This is going to be warm or cold. So this is going to serve as a warm sensation, okay? And then this will be cold. Do you feel the difference? Okay, go ahead and say warm or cold.
Cold. Warm.
Good.
Cold. Cold.
Okay.
Cold.
Okay.
Cold.
Okay.
Warm. 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 Cold. 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 Warm. Warm.
Okay. I'm going to do it towards the back of the part too.
Cold.
Okay.
Warm.
Okay. So it's looking good to me. I'm just gonna take a look with this UV light just to see if there are any spots that might indicate a fungal infection. I'm going to change the part and look more towards the ear. Okay. Okay. So nothing lit up to show signs of a deep fungal infection. I'm just going to take one more look here. Okay. So this is just a mild skin infection, potentially at the worst. Okay. Have you changed any hair products in the last month?
No.
Okay. Is it a new shampoo or conditioner?
New shampoo.
Okay. There's a chance that you might be allergic to it. So, does it contain sulfates, or do you know if it's sulfate free?
I'm not sure.
Okay, it'd be good to invest in a shampoo that's free of sulfates. I can definitely give you some recommendations on that when we end the exam. Okay. Next, I'm going to do a sharp or dull test, okay? So this is a sharp sensation. Do you feel that? And then this is dull. You should barely feel it as a kind of tickle. Do you feel that? Okay, go ahead and say sharp or dull.
Dull. Sharp. Dull. Dull. Dull.
Okay.
Sharp. Dull. Dull.
Okay.
Sharp. Sharp. Dull.
Okay. So you didn't feel that sensation. Okay. So what about right here? Was that sharp or? No. Okay. as a control group because I know you're not very good at having symptoms there.
Sharp.
Okay.
Sharp.
Okay.
Sharp.
Okay. So next I'm going to gently apply a conditioning treatment to the hair. You're going to feel a little bit wet. I'm just going to dot the hairline. This is going to really help with the dryness that I mentioned, so just relax. I'm just going to smooth that in with sensory brushes. This is a fine toothbrush. It's going to help your hair follicles to really soak in the treatment. And since this is a sensory brush, do you feel this equally on both sides of the part? Do you feel this as one or two brushes sensations?
Two.
Okay, one or two.
One.
Okay.
One. Two. One. One.
Okay. So I'm going to move on and change the section of the part. Your hair looks like it's getting a little less dry. Okay. I'm seeing a little bit less flaking here towards the ear. So the base of your irritation is near the crown of your scalp. I'm still going to do some sensory tests here just to make sure that it hasn't spread and that the visual signs are just latent. Okay. So I'm going to give you a puff of air. You're going to feel it as just a pressure. Do you feel this?
No.
Okay. Do you feel it here?
Yes.
Alright, and back here?
Yes.
What about now?
No.
Okay. So go ahead if you, let me know if you feel it once, twice, 3 times. And if you don't feel it at all, let me know. Okay.
I don't feel it.
Okay. So some numbness in the back area. Okay. So what about now here?
I don't feel it.
Okay, so that would be right laterally with the ear. Okay, I'm just gonna go near the tip of the face. What about now?
What?
Okay, so this section is numb. What about now?
2.
Okay.
2. 2. 1. 2. 1. 1. 1. 1. 1. 4. 3.
Okay. Just gonna brush this through. I'm going to do some measurements of the area where you said there was numbness. So just try to hold still for me. Just want to make sure I get this accurately. Okay, that was 4.1 centimeters total, but you had some really bad numbness towards the last 2.5 centimeters. Okay. Okay, so that is a lot more numbness than what we like to see. That should have been an easier test for you. So I'm a little bit concerned. What I am going to do is just massage this section to maybe free up your dendrites and your nerve endings, and maybe just a simple movement to the area might help you be more receptive to senses. Okay, so just relax. That's because this area is so numb. Do you feel this as a massage sensation, or is it still kind of numb to you?
Feels good.
Okay, that's good. So just keep relaxing. So I'm going to flip you over for a few brief tests, but before I do that, I just want to make sure you have basic sharp or dull sensations on this numb area, just to assess how. Okay. So go ahead and say sharp or dull.
sharp, dull, dull, sharp, dull, sharp, 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 dull, dull, sharp, sharp, dull, sharp,
Okay.
sharp, dull, dull.
I'm going to just give you a little bit more intense moisturizing treatment to this area. And this also has an icy temperature, kind of, to stimulate your nerve endings here. Okay. So I'm just gonna let that rest. Does that feel like cool to you?
No.
Okay. Okay. Does this feel like a wooden sensation to you?
Yes.
Okay. I'm going to bring it down your part. Let me know how many times you feel it.
1, 3, 3, 4, 1, 1, 2.
Okay. I'm going to do it again with a paper implement just so you can tell the difference here. So again, 1, 2, or 3.
1, 2, 2, 2, 1.
Okay, very good. Alright. And this is going to be a hot kind of piece of rubber. And again, this will be paper. So let me know if you feel paper or rubber, okay?
Paper, rubber, 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 paper, paper,
How was that?
paper,
Paper? Good.
rubber,
Okay.
rubber, rubber, rubber.
Okay. So now I'm going to have you flip around and face me briefly. I just want to make sure that the back of the head and scalp aren't as affected as these areas that you mentioned, okay?
Okay.
All right. Okay. Okay, I'm seeing a red cherry angioma here. It's completely harmless. Don't have to do measurements for that. Okay, we're going to do warm or cold again, okay? And this is just along the part. Warm. Warm. Cold. Warm. 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 Cold. Cold. Okay, a couple more, but I'm really happy with what I'm seeing so far. No. Okay. Just making the part a little bit more defined. Alright, now one more cold. Okay, so a little sleepy. Does this feel warm or cold or sleepy? Okay, so it's feeling sleepy. Alright, so does this feel sleepy or warm or cold? Or just sleepy? Does this feel warm, cold, or sleepy? Cold. Oh, it's cold, okay. Okay. Cold. Good. Cold. Alright, so I'm not seeing much loss of sensation back here. Okay. I'm going to just brush through. Applying a bit more serum here. Okay, and this is just more targeted to the areas of the scalp. A little less intense, but it's still gonna help retain moisture, which is what I think you really need right now. Okay, Madpy. So this concludes our exam. I am going to send you home with some of the conditioning serum that I applied today. And based on what the tests come back to see, you might have to take some antibiotics. And if not, either way, I want you to switch to a sulfate-free shampoo because I'm seeing more and more patients who have an intolerance for sulfate. It's just not good for skin. It's a cheap kind of additive to many shampoos that we want to stay away from, especially if we have recurring scalp sensitivities like you do. Okay? Okay. Alright. So, and I'll send you home with a list of shampoos that would be good for you, and I'll give you a follow-up call in about a week, okay? Okay. Thanks for coming to see me. I'm about to take a lunch break, so the office will be empty. You can take a little nap here, but then you have to be up in an hour, okay? Because that's when I'll be back seeing more patients, okay? Alright, bye.